Hello, how are you? My name is Maria. I'm going to be your nurse for today. How was your night? Good, good. So we're assessing orientation when we come in and introduce ourselves, okay? All right. Can I go ahead and do a physical assessment on you? Oh, okay. All right. Anytime a patient tells you no, they don't want you to do it, you can't do it. It's like assault and battery. When you it's assaulting me now. He fell. His wife told me he fell at home and he got a bump on his head. Before I start, you know, we're gonna pretend that his hair's got blood and everything, so you're gonna make sure you put on gloves. A lot of times patients haven't washed their hair because they came straight from home and have blood. You know, in the emergency room, they're not gonna do it, right? They're not gonna wash their hair. So we look. Can I mess it up a little bit?
Yeah, that's fine.
Okay. Feel he's got it so perfect. You feel for lumps and bumps, and you say, "Oh, I see where you hit your head. Oh, taking up his stuff." I see where you got a little cut, so you make a note of that. You look at the size of it, and if it needs, if you have a doctor put sutures or whatever, you look at all those things. Okay, just relax. Are you feeling confused or anything?
Yes, sir.
Oh, okay, he's confused. All right, and people can know they're confused. Okay, they know they're not themselves. You feel for the lymph nodes. Once I do that, bring my hands around and I feel for the lymph nodes under here. Okay? And then I'll feel in the clavicle, subclavicular. Alright? Alright. Push again, shrug your shoulders. Pushing against it. Okay. But you're feeling for symmetry of your shoulders and all that. Okay. Have you been having any headaches? No headaches? I'm just a little bit confused. I'm going to shine the light in your eye just to check your pupillary response, okay? Look forward. Now remember, you're checking for constriction. Now you check to make sure that the light is dim so that you can actually see it. We have a lot of light in here, so when you're doing your assessment, you might not be able to see it really quickly, but you're checking the response. So when you dim it, I usually do is turn off the overhead light, and then put my hand here to dim it, and then I bring my light in, and of course pupils are equal reactive light. If you want to check for accommodation, you have the patient look forward, and then you just follow the light. Okay, and then just check and see. Okay, that's accommodation, but most of the time we don't do that. All right, I'm gonna take a look in your ears. Sometimes you just look in the ear. The lights aren't on, but you'll look in the ear. A lot of times they'll have you checking to make sure there's no drainage, no blood, anything like that. Okay, and then I'll go on the other side and check this ear. Okay, all right. Can you smile for me? Facial symmetry. Okay. And everything looks fine. He's kind of cute. All right. Okay, I'm gonna listen to your lungs. Okay. All right. Take your head to the right. Remember to do that, because otherwise it'll be right. What? Breathing right in your face, right? Okay. Deep breath. I'm not gonna put it in my ear. Take a deep breath through your mouth. In and out. Out. Good. Again. Out. Again. Out. Good. Again. Out. Again. Out. Again. Out. One more time. Okay. One more time. Good. Here, air all the way down. Really good. Okay. Didn't that tire you out?
Yeah.
You see what I'm saying? Now think about your little 90-year-old grandmother, and you're telling her to do that in and out, and just watch your patient when you're having it. And we just done anteriorly. We have to do posteriorly. Okay. So make sure you watch your patient, especially if you hear something advantageous. I always start down here. I know for testing purposes, we're going to start up here. But when you're old people, especially your chronic lungs, listen down here first and make sure there's nothing down there. It's really bad. If you hear it down here, you're probably going to hear it. Okay? All right. So then what I do, I have him sit up a little bit and I'll listen to the back, especially if they're healthy and stuff like that. Okay? It's a nice scope. I might think it's mine. This is a good one, and it's not as expensive as you
not,
said
it's cheap.
as the Littman. I was a Littman girl.
Really cheap, yeah.
Yeah, I like Littman, but this one's not bad. You can really hear it. Okay, I always tell them, deep breath in your mouth, Again. Out. Again. And notice how the scope is going. I'm gonna take this so I can talk. Notice how the in and out. So notice how the scope is going. I move it down, some like in the S form, back and forth. Okay. Make sure that you don't put it over the scalp. You want to be able to hear, and don't put it here over the kidneys. Okay. But make sure that you don't put it over the scalp because you won't be able to hear it. And especially women like me, well endowed. Make sure you kind of use the scope. Remember how I told you before? You just kind of move it, just not a whole lot of pressure, but move the breast tissue so you can actually hear, especially. Okay. All right. Go ahead and lay back, Alex. All right. I'm gonna listen to your tummy. Okay. So you want to make everything. Remember, is skin to skin. You don't put your scope through the clothes because you won't be able to hear as well. Okay. So make sure this is warm and against them. But make sure the patient know you're gonna touch them. Okay. You listen first to the tummy before you start, doing all of that. But you tell them you're gonna assess their tummy, especially women when you start pulling things up like that. Okay. So you, yeah, you hear that. So you listen first. Sometimes you can tell if they have diarrhea, if they have hyperactive style signs. You ask them, when was the last time you had a bowel movement?
Yesterday.
Yesterday. Good. Was it normal?
Yes.
Okay, you're passing gas. I know. So if they're having a bowel movement, they're passing gas. If they can't, if they said that, these are things. If they have not had a bowel movement, say in a couple of days, you ask them if they're passing gas. Okay, if they're passing gas, you know it's coming. But if they're not passing gas and they haven't had bowel movement, they're probably a little constipated. Okay, and then you ask them about their diet. You make sure you eat a lot of fruits and vegetables, drink a lot of water. Okay. Like he was complaining about he fell, so I always focus on, was he confused? When did he hit his head? Things like that. You check his neural responses. You make sure that we're going to check his grips and all that kind of stuff. Okay. All right. So I felt. Then I will. Any pain here? You start light palpation first, and if you feel any pain, and okay. And then you feel, and you're feeling for lumps and bumps, okay? And you'll be able to see once his shirt is up, if he has any type of hernias or any type of masses or anything, you're feeling for that. Okay, all right. Then I asked him to go ahead and squeeze my hands, and we're making sure the grips are equal, okay? And then sometimes I'll ask them to raise their hands up, just to see, okay? All right, good job. Then I go down to his legs. Okay, if the patient has socks on, you take them off. Okay, because you want to feel their pulses, the pedal pulses, on the dorsal pad. I'm not going to check for that one, but just the pedal. Make sure, and you're looking, especially if they're diabetics. You look and see if their skin is clean. They have any fungus, any peeling of their skin. You're looking for the coloration of their feet. Okay, all right. So then I asked them to push. All right, now. And then I asked him to, okay, now can you lift your legs? Okay, perfect. Okay, so he can. All right, then I go back and I feel, people say the Homan sign. The Homan sign is no longer, a big thing now. We don't really check for Homan signs for deep vein thrombosis. Some people will say they look for Homan signs. I just feel back here for the popliteal pulse. Okay, and then I will look for his skin, make sure there's no tattoos, lesions, bumps again, less sores or anything you're looking for. Okay. Then I will move the patient closer to me, or if they're that closer to that side, I'll have them turn over so that I can look at their back. Okay. Make sure there's no bed sores or redness or moles, any problems with their skin, so that we can document all those. So a little bit closer to me, and then I'll have them turn over, and then I'll take a look, and we have a nice tattoo, and you'll document that it's got a flower, probably a dragon, whatever, and the coloration, you always want to document that, and then you look and say, oh, he's got a mole right here, and you'll document that. And you ask me, any changes in this mole? How long have you had it?
Forever.
Forever. Okay, no changes, right?
No.
Okay, so you look and you marking for those things, and there's nothing on his bottom. Okay. All right. Okay. If you need anything, you always call me. Show them the side rail. I mean the how to call you. Okay. So, you can pull it out. Then up. These you pull it out and then up. I haven't one of these beds in a long time. Always call me if you need anything. And oh, and make sure you look at his teeth because he might have dentures. And then you make sure they have 2 sets, upper and lower, because sometimes they'll come in with uppers and they'll say they lost their lowers, and then you're responsible for it until you document. And you look in their teeth, look at their tongue, make sure the tongue is moist and no sores or different things on their tongue, that kind of thing. Okay, and that's what I'm looking for. Oh, the nail beds. Make sure you check the nail bed. When you're doing the testing of the strength of the hand, you can just quickly look at their nail beds and see the capillary refill. And his is perfect. Okay? Quickly should be capillary refill. Alright. On women, most of the time we wear nail polish. Again, on women, we can take the nail polish. You don't have to take all of it off of them, but you can just take it off one nail, and that way everybody will know which nail that you checked the
Do we still check for skin turn?
Well, yeah, we can stick it. But if he's young and healthy, I did. But older people, you check. You're gonna have some poor turgor, but you check the dehydration. You look at the dryness of their skin, the flaking of the skin. Because on old people, their skin, they're losing elasticity. But yeah, you check for that too.
When you're checking the legs, you check them for the pedicles?
Yeah. But like I said, make sure on your I didn't take his socks off, but make sure on your patients you take off their socks. Especially if they wear the Ted holes, you need to take those off and put them back on.
How about like pitting?
Edema, yeah. You check for pitting edema, you'll see, you stick your hand in and how fast it responds, or how the depth of the edema is 1, 2, or 3 pitting edema. But we're doing a normal assessment. But most of the edema sometimes will be here in the lower extremities. A lot of times male, if they have heart failure, sometimes they have scrotal edema, and the doctor will tell you to elevate the scrotum on pillows. When you're elevating the scrotum, please, if you're using a towel, roll it up, but put it inside something soft like this, so that you don't cause any irritation or anything to the scrotum. Especially when the scrotum is swollen, the skin is very, very fragile. So you put it on something smooth instead of like you know how sometimes towels are real rough. You roll it and you put it in a pillowcase, and then you lift the scrotum and put it under, so that can help with the swelling. Okay.
For the test, I'm gonna do it on each other or on the mannequin.
We're gonna do it on the mannequin. On the mannequin, because we're gonna do it one at a time. So we're gonna do it on the mannequin. I know it's hard to move a mannequin. I'll think about if I let you use each other. We'll see. It's harder on the mannequin because I could hardly lift them. To listen to. So and that will probably take longer. I'll see. I'm gonna sell them. Selva may be able to help me. So we'll see. But today we're definitely gonna practice on the mannequins and on each other. Okay. You guys are gonna